container while you're having your lunch. And this is entitled Above and Beyond Botulinum Toxin. So that I could at least share with you some of the things that are actually happening right now in aesthetic medicine. And this is a branded one. I'm not again sponsored by this company, but because this is the only toxin that works for this procedure. Because I've done and I've tried the others, and those are the names of the other ones. We're more familiar with Botox. Ceumin is what is available, and it's going to be available in the Philippines. This is from Merck's. This is a German brand. Dysport is from UK and France. And the MyoBlock, which is for cervical dystonia, we don't use that for aesthetic. So, botulinum toxin injection by aesthetic practitioners. I'm quite sought for this lecture because this is something that is newer. It's a newer technique. Of course, it's not FDA approved way of injecting the toxin, but I think it's safer. So off-label, still it remains that crow's feet and horizontal forehead lines are off-label because only the ones on your between your eyebrows, the glabellar lines, that's the only indication that the toxin is for. But of course, we use it all for different areas: the platysmal bands, perioral lines, nasolabial lines, masseters, and hypertrophic gastrocnemius muscle or calf muscles. And some of you guys are probably wondering why you inject on those areas. Our beauty pageant contestants are the ones that come to me for this, so that when they're wearing their bathing suit, they don't have very, very bulky muscles on their legs. You also use it now on the trapezius muscles, so that when they're wearing their bathing suit, this is not muscular, so you want to taper it. But what I'm here for is the newer way of injection, and this is termed the zigzag pattern, 3D contouring, face contouring, the rejuvenation way, and they rely on a few things. The dilution is the most important, and the depth of injection. Okay? So, muscle contraction and facial expression. I'm not going to give you the conventional way of injecting it on the glabellar or the crow's feet because that's not my interest. But basically, it's still the same thing. Facial muscles of expression are striated muscles lying underneath the skin and are attached to the bone and inserted into the skin, such that when you make your facial expression, there's pulling of the skin. That creates your wrinkles. That creates the lines. Now, I'll be talking about intradermal injection because the advantages are that we can contour the face, we can enhance the skin tone, decrease the pore size, decrease sebum production, and of course, we want to maintain expressions on our face. Now, facial contour enhancement, this is lifting the eyebrows, making the eye openings bigger so that you don't look like you're getting tired. We can do higher and fuller cheekbone appearance, define the jawline, and chin enhancement because many Filipinos and many Chinese patients or people, they have quite a short lower third of the face. So we do inject that so we can drop the chin and we can elongate the area of the lower face. So skin wrinkling, intradermal injection technique. Botulinum toxin is injected at the dermal-epidermal junction, just at the level, very, very superficial. So when the toxin is injected, it blocks the superficial fibers that inserts into the skin from the muscle. When you usually you will look at diagrams of the skin, it would look like the muscle is detached from the skin, but it's not because you have the muscle, then you have the subcutaneous tissue, and then you have the skin. You have small muscle fibers that goes up attaches on the skin, such as when this pulls, you produce the wrinkling of the skin, okay? That's what happens. But of course, we don't look at it that way, and we look at diagrams. That's not how it looks like in the diagrams. So in skin tone enhancement, again, you will have smoothening of the skin, and it would appear tighter, giving less appearance of the wrinkle. And you can now look at the skin a little bit more with a glow. That also, the glow on the skin happens because when we inject, and you will see the injection points, we will be injecting multiple injection points all over the skin. And if you can remember physics again, when the light bounces off from the skin and they are wrinkled and they're all in different levels, or the surface is not smooth, the reflection of the light will be haphazard. It'll be all over the place. But if the skin is tight, pulled evenly around, then you can now imagine that there's going to be a nice reflection. It's okay, Doctora. It's okay. And there will be now a nice reflection of the skin from the face. That's why it will give you the glow. And what's most important and what's more fitting in our activity today is how it increases fibroblast and collagen. Okay? Now you're thinking, botulinum toxin, really? It can really do that? Because we're only thinking of how it relaxes the muscle. Okay? But studies have been made many years ago, and studies are ongoing to really show that there are better fibroblast production and collagen deposition. That's the reason why I'm giving this talk and entertaining your lunch. Okay, here is your human fibroblast with B-actin filaments. Okay. This is, above is your fibroblast, below are fibroblasts. The one on the, which one is that, right or left? The one that's shaped nicer, that a toxin is injected into that, okay? And the other one has no toxin. So now you can see that there's actually an effect on the actin filaments on the one on the fibroblast that was injected with toxin, okay? And this is an actual study. Now, with H&E stain, this is your before. I don't know how good it's coming out on the screen, but the after 24 hours later, you can see now a contraction of the collagen area, of the fibers, okay? So there is an actual thing happening underneath the skin, and we are not injecting into the muscle here. Okay, here's another study. I'm sorry about your lunch, but you're all doctors, and we do this even before. A Japanese doctor is thinking that perhaps the injection is not so much of the toxin, but of the saline or the sodium chloride that we dilute the toxin with. But there's an actual contraction on the one on the skin that was injected with toxin. Another study is that poor little buddy of ours is exposed to UV, so we can try and mimic aging of the skin. Okay, look at the non-treated one. It's still wrinkled, but the one that was injected with the toxin, it smoothens it. Okay, so there's a smoothening effect. And those are all intradermal injection. For decreasing sebum production and pore size, this is the mode of action. There's paralysis of the arrector pili muscle. Okay? And also, there is an influence on the production or blocking of the acetylcholine. And it has been seen that acetylcholine also helps in the secretion of the oil from the sebaceous gland. So we work on that. We work at the level of the dermis to do this. So we're injecting at the dermoepidermal junction. There will be diffusion and spread, very minimal, and we do it on a very, very diluted amount of the toxin. We don't do a strong toxin concentration because we want to spread it and dilute it only at the very, spread it and diffuse it at the very superficial level. Okay, I don't know if I could play this, but let's see if this is going to play. Is it happening? No. Well, anyway, I'll show you how superficial it is. It's like a skin test, intradermal, like you're doing a drug skin test. Very superficial, multiple number of injection points. Okay, so these are different patterns. You have the zigzag pattern and the hexagonal pattern. Zigzag and hexagonal on the lateral area of the face. This is the 3D disport lifting. A lot of injection points. Also in the middle portion of the face. That's now for the pore and sebum production. Okay. This is a before and after photo of one patient. Okay. That's kind of horrible photo, horrible lighting. But if you can appreciate in I think the screens on the either side of the room has better resolution. But this is the injection site, okay? Just on one side first. This is how it looks like, and this is how it contours it, okay? So on either side of the room, there's a better screen. And this is how superficial it is also. Now this is more just to open up her eyes. And that's my last slide. Thank you. Okay. I've done many, many patients and they've all appeared the same. So, and as you get better at doing the injection, and they come, it's addicting. They keep on coming for injection. What's good about it is you're injecting minimal amount and you're actually producing better lifting. It's more anti-aging. You can do the patients without worrying about production of antibodies because it's so minimal. And we're after the fibroblast and collagen regeneration. So we're not looking at muscle paralysis. Okay, thank you.